This conference will now be recorded.
Excellent. So this is our September 30th, 2020 Community Health Improvement Plan meeting, and this is our first time meeting since we defined our Community Health Improvement Plan at the end of 2019, and so this is effectively our kickoff meeting. So I'm just going to walk through a little bit about what our 2019 to 2020 Community Health Improvement Plan goals and strategies are. And I also have some on the process that we use to get here. And then we have some spotlights from our community partners and organizations just to highlight some of the resources that are available and to kind of kick our brains into thinking about what we can do going forward. And then the rest of the time is just a discussion on what kind of action plans we want to have, what kind of process do we want to have for how we'll collaborate and be able to maximize all of our opportunities and share resources. You're welcome to type into the chat box if you have questions or concerns or anything, and let me know. I'll do my best to monitor them, but I also have Jess Palma on who can also monitor those. If you message out to everyone or either to me or Jess Palma, we'll make sure we get you answered. So to start us off, we have a video that Jess was able to make about our Community Health Improvement Plan process. And it does a really good job of summarizing what we've done to get to where we are now. So just in summary, just a little bit more detail, we have the 3 priority areas, and in the past we've had 3 different work groups that we had to convene and discuss these 3 priority areas so that we were able to focus on them. And then part of our discussion later today will be, do we want to keep working in 3 separate work groups, or do we want to convene as a larger group more often and then break apart? I see a message in the chat box asking if I can make the screen bigger. By going into slideshow mode, I can now that I finished that presentation. However, I may have to do some work to get the right thing to be seen. And, whoops, I just canceled the whole thing. So there was this one time where Jess and I spent quite a bit of time trying to figure out how do we get a slideshow to show in presentation mode the right way when we're on GoToMeeting. And it takes 3 steps. And it's one of those things that I have a really hard time figuring out while I'm in the middle of doing it. So I'm just going to leave it as it is. I'm going to try to make it larger. And on your screen, if you push, there's a plus sign and a minus sign on the screen, and you can actually make your viewer larger in the center, and that might help. And I'm sorry, it would take me like 2 or 3 minutes to try to figure out how to get it to show properly. I hope that's okay. So we had the 3 priority areas. Healthy living is focused on improving nutrition and physical activity and preventing tobacco initiation, tobacco use. Mental health promotion and community resilience is focused on improving conditions to promote mental well-being, community connections, and community capacity to bounce back from adverse events which we've gotten some experience in this year. And then the substance abuse prevention work group is focused on preventing access to substances and reducing initiation of substance use and abuse. Through our discussions, we talked about having overarching principles, and they fell into these three areas: the equity, having this space for collaboration and sharing, and then promoting evidence-based interventions. And then in order to do this, we talked about having meetings where we convened to share knowledge, have capacity building activities, and then work to make health promoting environments more pervasive. And so last, we have our healthy living goals. So goal 1 is to improve availability of and access to good nutritional options. Strategy 1 underneath that goal is to assess and act on opportunities to improve nutritious options in communities. Strategy 2, support initiatives to repurpose or reuse unused or extra food. Goal 2 is to improve availability of and access to opportunities for physical activity. Strategy 1 is to support the development of infrastructure and the built environment that supports physical activity. And strategy 2 is to increase ability of local organizations to provide activities. And then goal 3 is to reduce tobacco use and tobacco initiation. Strategy 1 is to implement policies and practices that prevent tobacco use and initiation. And strategy 2 is to support healthy alternative activities to smoking. For mental health promotion and community resilience, we had 2 goals. Goal 1 is to increase community knowledge and skills to support good mental health. And then there's 3 strategies under goal 1. Strategy 1 is to increase availability of and participation in classes that increase knowledge and skills to promote good mental health. Strategy 2 is to increase community capacity to organize community building events and activities. And strategy 3 is to increase availability and use of community activity spaces for activities that build community connection and promote good mental health. Goal 2 is to further develop environments and systems that support mental well-being. Strategy 1 is to coordinate and systemize mental health safety net systems. Strategy 2 is to support the spread of trauma-informed trainings, policies, and practices. And then under substance abuse prevention for this focus area, there's 2 goals. Goal 1 is to prevent access to addictive and abusable substances, and there's 2 strategies under this. Decrease excess prescription drugs in the community, and 2, research and implement policies to reduce access to risky substances. And then goal 2, prevent and reduce initiation rates of substance use and abuse. Strategy 1 is to increase utilization and availability of healthy alternative activities to substance abuse. And then 2, support current organizations and programs to develop further to prevent substance abuse. So that's just a quick summary of these, and we can circle back to them when we have our discussions. I put in our agenda to switch into doing our community organization spotlights first because some of our presenters needed to leave the meeting a little early. So we will transition now into hearing from 4 community organizations just to learn more about what type of resources and opportunities that are available through their organizations or what they're doing towards these goals. And the first one that we have on our list is Joanne Miller, but Sheila, I believe you, or is it Jo Lynn that's going to be replacing Joanne today?
I will be doing it. Can I share a PowerPoint, or do I just need to read through it on my own?
You can definitely share a PowerPoint. We will end my screen share. And
I might need to be a presenter to do that.
Yes, I will make you a presenter.
Okay, sorry for the delay here.
That is
Unplanned change of presenters. I know Joanne wanted to be here, but she was not able to.
There you go. You are now a presenter.
Okay, let me get this going. So like I said earlier, I'm with Samaritan Health Services, and sorry about that little pop-up window. Let me go back. Our department is the community benefit department within Samaritan. So we're working in Lynn, Benton, and Lincoln counties. We're part of the Coastal Cascades Community Wellness Network with 8 focus areas. And those are the obesity prevention, chronic conditions, tobacco prevention and cessation, pregnancy prevention, and it's probably teen pregnancy prevention, sorry, oral health, behavioral health, and mental health, and substance use disorders, homelessness, and shelters, and child abuse, and neglect prevention. So those are 8 areas. Within those 8 areas, we have the Partners for Health is the big one, which is we're part of in this capacity with the CHIP. And Jeannie Davis, who's a physician over in Lebanon, is our current chair of the Partners for Health, but we do try to have a representative from our network to within one of those 8 focus areas to be our chair at any given time. So moving on, the Partners for Health comprises the CHEF grant, and prior to that, it was the CATCH grant, and that focuses on physical activity, nutrition education, obesity prevention, and forgive me the last one, nutrition. And so with that one, we bring pick of the month flyers to the tri-counties, the cooking matters and eating better, eating together, cooking classes, the annual summit, which I think a lot of you were able to participate in a couple of weeks ago, and then monthly meetings with a variety of partners in the Tri-County region. And then our next part, and this is the screen kind of covering this, the social accountability funding. We have a different fund for each of the 3 counties, and these are funds that are available for the community, and each county gets about $150,000 per year, and it's a grant giving. So organizations are able to write applications, and then we grant money to them. We prioritize needs that the hospital has identified through I think it's every 2 to 3 years, we do a big needs assessment for each county. Really important to distinguish that the funding is from the hospital. So for Lincoln County, it is North Lincoln County and North Lincoln and Newport hospitals, not the foundations that are associated with that. So the foundations have a lot of other funding streams that they do other work in the communities, but social accountability funding is different. Committee members, the committee that decides who gets the grant and how to break out the money are members of hospital staff and community volunteers. And unfortunately, I don't know if anyone was applied, but the funding cycle for 2021 to 2022, starting in January, those applications were due last Friday at 4 p.m. So it's closed for 2021. Agencies will be notified in December 20 and January 2021, and then the new funding cycle begins again in August 21, and then applications for the following year will be mid to late September of 2021 for 2022 funding. No, not going forward for me. It's really frustrating. Sorry about that. So we do have other. Excuse me on this. I'm having a little technical difficulty here. So another part of the community benefit arm is that we have the opioid federal grants. Currently we're in the middle of the second one. We had a planning grant that ended last year, and that was to allow us to apply for this current opioid prevention grant through HRSA. It was $1 million for 3 years. And our partners include the Confederated Tribes and Select Indians, and Lincoln County Health and Human Services, among other community partners who have just been fantastic partners and support in this area. The plan, like I said earlier, the plan was developed in 2018 and 2019. We recently received a planning grant, an emergency response planning grant for opioid use disorder and substance use disorder. That began September 1, although we did get our notification about a week after we were supposed to begin working. So we will be working with community partners to develop an emergency response plan like COVID, a earthquake or tsunami. Hopefully that never happens. But that will be something that we'll be working on over the next 18 months. We have other funding opportunities through Samaritan, not necessarily through community benefit. Our sponsorship. So Samaritan has funding set aside to sponsor different community efforts that are aligned with our mission and goals. Like, for instance, oral health has done a lot of stuff over the last couple of years. We've partnered with dental care organizations in Lincoln County and other counties. We've done part of the tabling initiatives for Samaritan House fundraisers and Neighbors for Kids. So any community initiative or sponsorship that fits into our overarching goals and mission statement we will consider. Again, that's important to distinguish. It's not community benefit, not my department or Jolene's, but the actual hospital, the Samaritan Health Services that does that, and those opportunities are available on the Samaritan website. I'm not entirely sure what the web the URL is, but if anyone's interested, I can find that. And some of the other things that we've done is we fund, at the end of the year, we do a lot of, with leftover funding, we'll donate to food banks and CSC. Last year, we gave $50,000 to CSC to help them distribute to clients who didn't meet their income thresholds, but did need additional support with rent or utilities. So those are some things that we've done with those other funding opportunities. Any questions?
No, well, I have a comment. Carol Adams from the Coast Range Food Bank.
Yes.
Your program has, we submitted our grant last Thursday for the assistance. Yes, and it is helping. It is going to help us, and it's helped us 3 or 4 years in the past with special purchases for health needs and organic and dietary foods for our clients. So and also there has been a tremendous optimism in our clients about their health and their future since Samaritan has gotten so involved in Lincoln County. Okay, thank you.
Thank you for your work out there. And we are going to be looking at those applications in the coming. We're supposed to get the packet in the next couple of days, so we'll be looking at those soon. So I look forward to reading yours.
Thank you.
And unfortunately, I do not know how to stop sharing my screen. There we go. Never mind. I figured it out.
It's tough because your whole interface changes when you start screen sharing. So you're used to operating with one look, and then you select to screen share, and suddenly you can't see yourself, can't see what everybody else is seeing.
And we use a different Samaritan. We use we use Microsoft Teams, which I'm more familiar with. So I'm not that fluent in GoToMeeting. So I hope you guys aren't looking at my screen anymore. If you are,
no, yet. And so could you post in the chat box the people to contact if you want to be on the planning grant for the substance use prevention emergency response? Could you put the link or the person to contact with their email address in the chat box so that if one of our substance abuse prevention work group members wants to join that, they would just be able to click on that and start writing the email right now? And then could you also, for the Lynn Benton Lincoln Partners for Health Committee, post the person to contact for that, for those that might be interested in joining that work group. They tend to be a little bit more focused on healthy living, though I do think they're branching out a little bit more into mental health promotion too.
Okay, absolutely.
Thank you. Any other, one thought I had thinking about what we could do with this group going forward. You know, we missed being able to collaborate for the social accountability funds for this round, but you know, we have many months now before the next round opens, and so it gives us an opportunity to kind of use this group as a way to plan some applications that are strong. And I put the link to the social accountability page in the chat box if anybody wants to look at it and just see what type of things they're funding. And hopefully as we get a little bit closer, someone from Samaritan Community Benefits could give us some like social accountability grant writing 101 classes on like what's going to make a really strong winning application, because we want to win.
Yeah, I will, you know, and I actually, I think that was an oversight of ours, because we did have someone who had like an 11th hour, he submitted and it didn't fit our format. And we were like, we can't accept this. And he, as a rock star, was able to turn it around in an hour and get it back to us in the proper format. But, you know, we could have saved her a lot of time and angst by just having those expectations really clearly stated and doing a little community training on that. So that will be something that we'll try to put together for the next funding cycle. So for those of you who ended up being really stressed out about our application, I apologize.
Okay, so the next one that we have on our list, and we're pretty far ahead of schedule, so we can definitely have time to ask questions. The next I have is Dusty to talk about extension, resources, opportunities, specifically building back better, and Juntos en I'm not gonna say it right, Colaboración. I know that's wrong, but someone can correct me, please. And then if there's other things, and if you have if you want to share your screen, we can. I'm not going to put a slide up because it literally has like 8 words on it.
I don't need any slides, but thank you very much. So thank you for the opportunity to be able to share some of our work. The first thing I want to talk about is Juntos en Colaboración, which is a group that's come together really because of the COVID-19 response. As everyone was working really, really hard to be able to help everyone in the community understand how COVID-19 is spread and help with prevention efforts and help people get connected with testing, we were looking from the extension on ways to be able to help out. And so one of the things we did was we helped connect the College of Public Health and Human Sciences TRACE team, who was doing some estimates of prevalence. They were doing testing in the Newport area. And Araceli Mendez, who's with us here today, was part of that team who did testing in the Newport neighborhoods. What happened was we heard the results were not good after that prevalence testing, right? That there was 3.4% prevalence. And so immediately we were all thinking, how do we help? How do we support our communities? And through some conversations, we recognized that there was some help needed in getting the word out in Spanish and in Mom languages. So it was a whirlwind. We formed this little group of ours with just a few folks. That included the Lincoln County Health and Human Services team, Jess Palma and Susan Traxel, Amy Snyder, Rose Giroux, who was the Vista when we began this work, as well as the Olala Center, D team, and Alex Umakinga, and several of us from our extension service, including our family and community health team, as well as our small farms and master gardeners team. We mobilized quickly to think about how could we provide additional services on top of the already great communications going out. And what we thought about was that we know that people, from research, people trust 2 main sources for health information. That's doctors, and then there's friends and family. And so we thought there was great information coming out from the health system, from the county. How could we build upon that by maybe utilizing friends and family and networks to be able to share messages? So we were able to recruit community members who spoke Spanish and Mom to record some wonderful, really low production, really great selfie videos that we put together with the help of the Health and Human Services team, with Oregon Health Authority. And I invite you to check out our YouTube page where we post those videos, as well as the Lincoln County updates and some other great videos there. It's called Novedades del Condado de Lincoln. And that was really our first activity. Since then, it feels like so much has changed. But one thing that we also recognized was that there was this Lincoln County effort in thinking about the recovery from COVID-19. So thinking long-term about how do we help our communities build back better is the name of it. And you can check out the information about that on the Lincoln County website if you haven't seen it. Essentially, it's trying to gather community members together around how do we fix some of the things that we knew were issues before COVID-19 and put our efforts there. Also highlighting some of the things we've learned about the needs because of COVID-19, because COVID-19 shone a light in the dusty corners of some of the issues we know are there. One of those examples is internet. So one of the big initiatives through the Building Back Better effort is to enhance the internet bandwidth for all community members, increasing access to online access. And then we are also, through Juntos en Colaboración, we're working in alignment with that and trying to think about the future and how do we support a thriving Latino, Latinx, Indigenous communities of Lincoln County, and thinking about what are the things that are needed. We have a couple of other activities we're working on now. One is to engage community members in our work. Right now, we're really organization-based, and we're trying to get to a place where we're integrating community members into our work, and that they will essentially direct the work, and we can provide the supports and the resources to help work with them, juntos, together, en colaboración, collaboration. So that's really our mission. And Araceli Mendez has joined our team as a Master's in Public Health intern who brings a world of experience in public health and working with the Guatemalan communities and Spanish-speaking communities in another county. So we are really grateful to have her on the team, and she's going to be doing some community engagement work to help us understand what are the concerns of our community members and what are the kinds of things they'd like to see change. And then we will be sharing that back with all of you, I hope. We'll be inviting you all to a presentation that Araceli will give later this year. I look forward to sharing those findings with you. I also briefly want to say that as we're thinking about engaging the community and really bringing them into this work, if you are working with families who are Spanish speaking, Mom speaking, identify as Latino, Latinx, Indigenous, and they want to have a leadership role in their community and helping build it back better, please connect them with me or anybody else on our team. We will be really grateful to make those connections and provide some opportunities for them to be involved. I also want to acknowledge our SNAP Ed team. They're doing really amazing work in our extension service, providing great resources in Spanish and English through their SNAP Ed activities. So Jen Pettit and Stephanie Russell and Beatriz Botello. So do reach out to them if you have any interest in the kinds of things that they do. And lastly, I want to take just a couple of minutes to talk about some new resources that are available through our extension service related to mental health and substance use disorders. Some of you I've met with already to talk about this project, but we do have some updates that I want to share with you. So we're new to this area. We're excited because our College of Public Health is encouraging our family and community health team to be able to mobilize our university resources to assist all of you in your work. And we have recently received funding from 2 sources that were specifically for land-grant universities in the extension service through the USDA, which might seem a little weird because the USDA does agriculture work, but they actually are really invested in opioid prevention specifically because of the high risk among ag workers. And so that's foresters, fishermen, as well as farmers. There's a huge need and they're a huge high risk population. And we have a lot of those folks here on the coast. Then another stream of funding that we just recently received, this is, we haven't announced it yet, but I'll tell you today that we received $1.1 million from SAMHSA to become a technical assistance university. So we're going to be able to mobilize some resources for training and additional supports to you all. Some of that will include mental health first aid training. There'll be a substance use 101 training. There will be resource guide development to be able to house all of the different community organization information to help get people connected and aware of all of your services and programs. And we will be connecting with all of you to make sure that our work is meeting your needs and providing additional services to you to be able to provide your programs and services. So if you have some interest in that, please do reach out to me. And through that work, I was thinking about the chip here, this work, and it seems like our Coast to Forest, that's what the name of the work is, that's really aligned with the mental health group's Goal 1, Strategy 2, and the substance abuse prevention group's Goal 2, Strategy 2. So we do hope to get involved in that. And we're bringing on a really wonderful person to our team. His name is Ivan Estrada, and he's a mental health first aid trainer who's able to provide trainings in English and Spanish. So we really have a lot to offer with our work. So anyway, stay tuned. I'll keep you updated. And Amy, thank you very much for the opportunity to share.
Thank you, Dusty. Do we have any questions or comments for Dusty about what she discussed?
I will put a link in the chat to the Coast to Forest website if anybody wants more information on the mental health work.
I guess that is a good question of if one of us have a group of people who are interested in having mental health first aid training or some kind of information like opioids 101, would they just need to contact you, or is there going to be okay, so that's the best way, is just contacting you. Would you mind putting your email address in the chat box too? And when we download this recording, it will download basically a transcript with all the comments in it. So that's how we can kind of capture all of the different websites and email addresses that we want to have access to.
You got it.
I am using my teacher wait time right now just to make sure that I have space for someone to formulate questions or comments and then be able to actualize them. Okay, well, I have budgeted into our time a break so that we can get up and move about, and we're right about that time to take. Do we want a 5-minute or 10-minute break? Depends on whether you need to make tea or not. It takes at least 6 minutes to make tea, I'm just saying. Okay, so 5 minutes is what I'm seeing. We have 1 10 and 2 5s. We're voting
another 5.
I see 6.
Another 5.
7. We'll do another 5. Let's do 6 minutes, and then we have a nice little compromise. All right, so we'll start back here at 3:01. So you're welcome to get up.
Thanks, Amy. I also wanted tea, so this is very convenient.
Hello, everybody. It's 3:01, and we are going to start coming on back. If you can hear me, and start making your way back from your tea kettle. That's where you are. Excellent. So we're working our way into our back half. We have two more spotlights. One is on coastal equity and inclusion. When we did our listening sessions and our planning meetings for our 3 focus areas, the Coastal Equity and Inclusion Committee did not exist at that time. So now we get to kind of reformulate our connection with this organization now that we have an equity group. So we have Rosa, and I think Rosa, is it just you, or do we have Rachel as well?
Today Rachel is not here. She couldn't make it.
Perfect. I'm very happy you were able to join us.
I'll be by myself, so be gentle.
Do you have slides to share?
I do, but I'm using 2 computers, so I don't know. I think I'm just gonna kind of read.
Okay, that works fine for us. If you just want to go ahead and tell us about coastal equity and inclusion, just give us a big idea, some of the ideas about how it's structured, and then the subcommittees.
Okay, thank you, Amy. So probably, I don't know how many of you know what the coastal equity and inclusion is. Some of you do. So the Department of Human Services has a equity and inclusion committee for employees, and throughout the whole state, and throughout the state we have districts, and every district has an equity and inclusion committee for employees. Though community partners are allowed, and also community members. But traditionally, these groups are for employees, Department of Human Services employees. And I was working for District 16 in Hillsborough, and I was part of the committee there. And then I moved here to Newport, and there wasn't one here in Newport. I had to go for 2 years to Corvallis to participate in the Equity and Inclusion Committee. So somehow throughout the 2 years, I was noticing that nothing was related to the coast. Everything was related to the valley, and they were sharing resources, they were sharing information, all related to the valley, and nothing to the coast. And so I suggested to Sandy Chase, she's the district manager, why not if we could have one for the coast. And she thought about it for some time. She finally said, well, if you think you can do it, go ahead. She gave me the green light. And our office here in Newport is really small. So for this group, for employees only, I knew that was, not really possible. Plus, to me, we as employees we have so many trainings in equity and inclusion. And so the only person we can bring it down to is to our clients. And I thought the real, the people that actually can bring the equity and inclusion to the community is the community partners, because they are the ones that actually have the relationship with the community. And so I invited community partners, and I was so surprised and greatly and very happy of the response. I think this was something that we didn't have here in Newport and Lincoln County, and the response was like, wow. And so I don't know, but I'm just a benefit eligibility worker. So I'm not a manager or nothing at the HS. And I really felt overwhelmed with the response and the people that responded with their, the titles and what they are responsible for. And but my manager, Alma Baxter, she is really, really a great person and a great manager. And she's been supporting me all the way. And she doesn't tell me what to do, but she is there for me anytime. And that's been a great, great help. Then also Rachel Cotton, she joined us, and she's also my great support too. And so that's how we formed the Equity and Inclusion, the Coastal Equity and Inclusion Committee. Our purpose, I'm not going to tell you our vision yet, because we kind of formed a huge group first, and then based on the talks and the needs of the community, and we started to think about what needed to be done, and different interests and different, so then we formed subcommittees based on the interests of each group. So we're one group, but with subcommittees. And so one of the subcommittees is working on the vision, mission, and goals. And Rachel is in charge of that subcommittee, and she's doing a great job. We have beautiful mission and vision, and it's, but we're gonna have one meeting just for that, to bring it to the whole Coastal Equity and Inclusion to be approved. To, this is what she did, and we need to vote on what is going to be approved. But the purpose when we started, the purpose to create a Coastal Equity and Inclusion Committee is understanding of the diversity, the mix of people, inclusion, what we do with diversity, social justice, human rights for everyone, cultural competency, hard words for me, or ability to flex to meet all clients' needs, universal access that is designed, programs designed for everyone to use. And so we had this blurb. Our purpose is be the designers of environments, communications, as well as the delivery of programs, services, and activities to be usable by all people to the greatest extent possible for all communities without distinction of race, color, age, disability, religion, national origins, and political beliefs. That was our, and then I saw this phrase that I really like. Diversity is being invited to the party. Inclusion is being asked to dance. I like that. And I'm going to explain a little bit about the structure of our subcommittees. So the whole coastal equity and inclusion is under the umbrella of the Office of Equity and Multicultural Services, which is in Salem. And we're supported by Antonio Torres. He is the manager of equity and engagement communities. So he's supposed to take care of us, Antonio Torres, and Rebecca Arce, and Mireya Williams. Then in our board, we have me as a chair, Rachel as a co-chair, Alma, my manager, she is my secretary. I always get a kick of that. She's just awesome. I just have no words for her. And our treasurer is Sheila Stiley from the Northwest Coastal Housing. She's also a great person and great with the community. And so the whole group is around 70 people right now. And the subcommittee's main goal is to assess our diverse community current needs based on the lack of equity and inclusion, and to promote equity and inclusion. Our subcommittees can be formed by the request of at least 2 members and review and approval of the board members. The subcommittees can work on as many projects as they want, and they can dissolve after finishing that one project or continue to work on new projects. Right now we have the visioning subcommittee is working on our vision, mission, and goals. And we have the tribal subcommittee just recently formed, and they're going to meet monthly. We have the LGBTQ2SI plus subcommittee, and they've been meeting every 2 weeks. And the last but not the least, is the communication subcommittee, which is being led by Beatriz Botello Salgado. She's a rock star. She does, I mean, I don't know how many Beatrices are. She does so many things that I'm like, whoa. I wish I had all her energy, and you know, she's awesome too. I mean, all of you are awesome. It's just amazing. Like I said, when this Coastal Equity and Inclusion formed, I was so impressed. And because this community is not just about titles or about, okay, we'll just give a report, you know, at the end of the month. No, this community works every day and gets together and looks for solutions and listens, because that's very, very important when you listen and you act on it. And I mean, I just, everywhere I go, I'm so proud, you know. And this community is just awesome. And I was in a meeting yesterday with the HISPNet, which is the Hispanic ERG for DHS. The ERGs are employees resources groups. So I was with them, and somebody in the meeting was complaining about the lack of communication in this time of the COVID and the wildfires. And I go, I'm so sorry, because this person was really stressed about it. And I go, I just have to say something. Please tell me, what county are you talking about? Because here, I mean, here you cannot say that. I mean, this is like every day the information is up to date out there, and that's not the case in this county. And she's like, yeah, I know your county is doing a great job, but she was talking about Clackamas County. And I go, whew, okay, because that's not, when you're saying that like in general, well, it's not fair for the people that is really working really hard. And you know, when you say that in general, it seems like everyone is doing that. And that's not the case. So that is in general, that's the idea of the subcommittees and the committee, the whole committee. And so the subcommittees, they meet independently every month or every time they want to, they need to. The big whole committee, we meet twice or every other month. So there's not that many meetings. And we've had presentations of I think the meeting in August or in June. That was when the COVID was really, really, attacking everyone. And so we had, all the community was reporting everything that they were doing and sharing resources at the meeting. It was, we did nothing but that. It was a great meeting. The one in August, we had Joanna Costa and Benjamin Bradshaw presenting on new bias law and DOJ reporting hotline. There's a new hotline for, and they presented that information. We had also Jorge Guzman from, can't remember the Live NW, I think is. He presented the Mayan languages, presented original Mayan, the origin of Mayan languages. And this was about the Mam community and where they located in Mexico and in Guatemala and all that. It was very, very interesting. And
so
all
just
our
for a time check, we have about 2 minutes before we'll need to move on to the next one.
Okay.
Do we have time for, or are there any questions that anyone has for Rosa for the coastal equity inclusion? Or Rosa, do you have any last things you wanted to make sure you were able to say?
Yeah, real quick, I wanted to share that this year, because of the COVID, the state convention was canceled because it's live. And they canceled first, but now it's going to be virtual. And it is great presentations. It's going to be virtual. This is for employees only, but I was given permission to share, and I'm going to share that later on with the equity and inclusion, because there's great presentators and about equity and inclusion, compassion fatigue, doing what's right, even if it means standing alone, building inclusive teams, intersectionality versus intersection identities, why equity, the importance of intersectionality, and so on. So I'm just gonna share that later on.
Thank you. And then Rosa, I saw that you put your email address into the chat box. So if anyone's interested in being added to the Coastal Equity and Inclusion Committee list to be able to get access to the meetings and the minutes and all sorts of wonderful things. And there's a lot of resources that get shared out through those lists, especially if you're doing any kind of service to community members who may need access to those resources in Spanish, or just more knowledge about what resources are available. A lot of that gets shared out through that listserv. So it's a good list to be on joined with. And so with that, we'll move over to our next agenda item, which is our last spotlight, which is on Recovery Month. And I have Rick on our agenda, and we haven't planned what we are going to say other than that we're going to talk about Recovery Month and what we did And we were fortunate to have Jess and Sarah also able to join us. We didn't quite know who was going to be able to come to this meeting considering wildfires and COVID. So Rick, we'll go ahead and start with you. If you want to tell us a little bit about Recovery Month, what usually is Recovery Month, and then a little bit more about what we've done this year. And then we can just have a kind of a moment just to reflect on what we did and why we did it.
Well, awesome. First of all, I'm glad Jess is here. I'm glad Sarah's here. I'm glad Jolene's here, Shelby, Shayla, because all of that every one of these people were involved with what we did this year. Years past, I became part of the group in 2014. We held a program or a celebration called Hands Across the Bridge, and it is a celebration that resembles what happens in Portland on Labor Day week, on Labor Day over the, I think it's the Ross Island Bridge, whatever bridge. Anyway, well, due to COVID, we didn't get to do that. It's normally held on the Walport Bridge down in South County, and we bring in all of the groups and everything. So this year we started meeting about the second week of August, and we sat down at the table, kind of like what we're doing right here, and say, okay, how can we do what we do in person together? And Isabel is on here too, and Isabel had a pivotal part of putting a resource packet together so that we could see what everybody did, and that's on the website also. So we had a plan, and I'm just going to talk a little bit about the plan. Then I'm going to ask some people to help me tell what happened, because you know better than I do. The first thing that we did is we had a proclamation, which Jess put together and had that, and that's done every year with the Board of Commissioners. And Sarah sat in for me because I was at another meeting, and we presented what we were doing. Then we had a couple events that we called tie-dye masks with the Chance organization. There was one in Newport, there was one in Lincoln City. The one in Newport, well attended. The one in Lincoln City was pouring down rain, and they didn't have as many show, but it still worked. We had the mindfulness event, and I'll ask Sarah to talk about that in a second, because I know that was at the Newport Library. We had a beach cleanup, and I think that went. Jolene had what was involved with that, and I'll ask her to reach that. Some of the things that didn't happen is, we had fires. So we didn't get to do the cardboard testimony that was going to be held in Lincoln City. That's going to be held in October. And the Lights of Hope, they weren't allowed to do that due to that they were still in phase 1 in Toledo. We did have a drug take back in Walport yesterday, and I don't know how that went, but I'll ask Sarah to kind of talk about that. And Shelby, I know you had something involved, but I don't know which one it was. So what I'm going to ask is, first of all, Jess, can you update us where we are and what we did? Because I kind of had my hands in little bits of everything.
I'm going to do the worst thing ever. Rick, unfortunately, I really didn't get to participate in Recovery Month this year because of the wildfires. I think the biggest thing that I really did was I just continued to ask Amy and Sarah, if they could take over things, and they did a fantastic job, and I'm really grateful to have the team that we have. But
Thank you, Jess.
The sign of good teamwork is that we constantly say, well, actually that person did it and that person did it. So Sarah did a lot of the social media presence after the wildfire started, but Jess did create all of the Facebook events for all of the events that we had, and those continue to stay there while wildfires were happening. So there was that contribution in there too. But then Sarah could speak a little bit more about everything else, because she really held us together.
Yeah, I just did what I was, what was left. You guys, this year was so cool for Recovery Month for me coming in. It's a bummer that the Hands Across the Bridge didn't happen, but what was really neat to see is all the organization and collaboration that came before September, when everybody got on one of these type of calls and talked about what they could do and how they could help. So for example, Reconnections Counseling, they did some videos, some recovery story videos, which then Jolynn with Samaritan was amazing and helped edit some videos. And then she got them over to me and I figured out how to put them on Instagram. So it really just highlighted how much everybody has some expertise in area and connection and how well everybody works together, which was, I couldn't have done it without Jolynn's help. And, you know, I imagine if Reconnections was here, they would say the same thing. We also pulled together and we were able to get some t-shirts and get those distributed. So you'll see some out in the community. It has the National Recovery Month logo on the front and then a whole list of community partner logos on the back of the t-shirt. Part of the social media campaign that we all agreed on ahead of time was to use the hashtag Lincoln Recovers. So if anybody here wants to go and look at those 1-minute video spots on Instagram, search hashtag Lincoln Recovers or hashtag celebrating connections. See, Lincoln Recovers is easier for me. So those events happened. What else? Oh, so the drug take back event yesterday was in collaboration with PATA and the Sheriff's Department. That typically coincides with Hands Across the Bridge and then down in Waldport that same day. Seashore typically does something annually, as well as Cruising for Crabs. So it's just a great day for having lots of people in the community. Yesterday, Kevin Kemper with the Sheriff's Department and I just kind of hung out all day, and we had a couple people stop by and give some of their medications to take back. So it was still a great thing to still offer and have available, and we'll do that again next year, of course. So, and I think it also highlights how we have a kind of a different framework to be able to offer different things next year, or in the event of some other unforeseen calamity that we don't know, hopefully is not coming for us. So I think it's kind of developed some new skills. And I hope I captured what I was going to say.
Your mindfulness event that was at the library. I know you were involved with
Shelby. Yeah, Shelby and I went down and did that. Actually, if I could let Shelby talk about it a little bit, it was awesome. We had a couple of her folks come down for that. So you want to share a few words, Shelby?
Yeah. So we had, it was called Mindfulness in the Park, and it was the week, man, right after the wildfires. And so not only was the air quality a little bit less than awesome, it wasn't to the dangerous level though, otherwise we would have canceled it, but it was also said that it was going to thunderstorm during the time that we were going to host the event. And so, you know, we still put it on because we still wanted to make sure that we offered it. We thought that that was important, and it was amazing. I mean, the weather cleared up for those 2 hours we were outdoors, and a couple of my folks came, and Sarah and I went through some just short mindfulness-based techniques. And so, you know, just short 5 to 10 minute techniques, and kind of talked a little bit about why these are important and how they support recovery from mental illness or addiction, and a little bit of history behind each of them. So I had a fantastic time, and the ladies that came really participated, and you could tell one was yawning by the end of it, which is what you want to see from a mindfulness event, right? She was so calm at the end of it, and it was an awesome yawn. It was not a bored yawn. And the other event that we had planned did get canceled because it was earlier. It was really close to the wildfires, and it was, again, an outdoor event to support social distancing, and we just couldn't pull it off with the air quality. And that was the Recovery Altar, and I still love the idea. I totally want to do this again if we ever have the opportunity. It was going to be held at the beach, and we were encouraging folks to bring any sort of natural item, like a stone or feathers or flowers, anything that could be washed away into the ocean and not disrupt the environment, and to place it on like our natural altar that we were going to make. And this would either be to celebrate somebody in recovery, to hold a place for somebody who hasn't made it to recovery, or to honor those who have been lost. So it's just, really simple, easy, beautiful way to celebrate Recovery Month. And I totally want to do it again in the future. So yeah, those are the two events that I helped with. And I just want to echo what Sarah was saying. I really liked planning the Recovery Month events. Like, it was so cool to be able to offer a whole month worth of events. As we know, people in recovery from mental illness or addiction, and especially on the coast where there's not a ton of opportunities to socialize in a way that feels safe to them, and duplicate that with the social distancing issues with the virus. I mean, everyone's feeling super lonely and isolated. So it was just really cool to be able to offer a month worth of events that were going to be safe for the virus and also safe for their own recovery.
And that's precisely the reason I wanted to bring this discussion into this work group, because we had the 3 different priority areas and we all met separately to discuss those priority areas of healthy living, mental health promotion, and then substance abuse prevention. And there were so many themes that were the same across those different work groups about needing to have more opportunities to do healthy connections with other humans in a space that is, health promoting and happy. And so, just thinking about doing these events, like, let's get them as far as we can across the county and engage as many people as possible. And it really could have been a good model. It can be in the future too, a good model for how do we involve our healthy living work group members, our nutrition work group members, our mental health promotion work group mentors, our group members, and our different recovery month, our recovery service providers all together in doing activities that are creating this environment that has just a wealth of activities that can be done that are health promoting across. And it doesn't require a government agency to create those activities, but we can really empower and collaborate together as a team, and we all do something small, but it creates a big systems and environmental change. So I'm interested to hear, Rick, did you have more too that you wanted to mention?
Well, the only other one thing, and like I said, Jolynn and Shayla, they had intricate parts of different things also. But the one thing that I think that we met our goal, and was the theme for this year was Join the Voices for Recovery, Celebrating Connections. And what you just said is exactly what I think we pulled off this year. Jolynn, anything from your event? Just quick. I know you had a lot up there, and it was right around the fire time also.
Yeah, it was luckily a couple of weeks after, so the air had pretty much cleared up, but we had 11 people come to the beach cleanup in Lincoln City. Amy was there, Sarah was there, and Shelby was there as well. And I know that there are others on this call who wanted to be there too, but it was a little bit hard with being a little bit close to the fires. I was going to actually share this photo, although I don't know if you guys are going to be able to see it from the screen, but I can kind of hold it up. This is a photo of a group of us towards the end. We had a couple people leave in the middle, but just a picture of us with all the bags of trash that we were able to clean up. And I don't know, I just thought it was a really fun event. It was my very first recovery month getting to be a part of, and so it's definitely giving me a lot more ideas. If we wanted to keep the beach cleanup as a recurring event, it would definitely be something that I would love to start planning, even a few months in advance. And I also am on the employee activity committee at the Samaritan North Lincoln Hospital, and they love doing beach cleanups too. So it would be cool just to be able to maybe partner with them, because then they can get the word out about the event to all of the Samaritan employees in Lincoln City. And I could find a way to also try to get the word out to the employees in Newport as well. And then maybe we can do a little bit more make a flyer and different things like that that I can deliver to the other recovery community organizations, or you to your own organizations, and we can get clients and different people to also attend. I think it could be a really big event that would be super fun. But yeah, just it was something that I thought of really in like the last week of August. So we didn't have a whole lot of time, but I felt like for the people who, were able to go, it was a lot of fun. We had fun, so.
Perfect. Well, thank you, Jolene. No, Amy, that's it. I appreciate your leadership in pulling this all together. And even though Jess humbly tells us she didn't, thanks Jess for all of her behind the scenes pulling the things together, because it wouldn't have happened. And everybody, thank you so much. It's recovery is 1 month that we call it in September, but it's 12 months a year. And so I'm actually going to be on the radio tomorrow, and I'm going to be talking about Recovery Month with Casey Miller. So we'll be bringing it again. So back to you, Amy.
Fantastic. Well, that pretty much ends the structured part that I had planned. And now the rest of the meeting is just for us to discuss how would we like to move forward. We have these goals and strategies, but it really is left open to the different organizations and active, engaged community members to really kind of partner together, collaborate, and really our role with the health department is to help facilitate that. And we don't want to be the drivers of it, but we want to provide supports that help. So I think, our biggest question right now is, how do we really support collaboration in a time of COVID? Is there any thoughts right now on meeting structures or how often we meet, considering all the other different meetings that we have? What would we like to do to facilitate collaboration for our community health improvement plan?
I have one thought. I'm not sure if we can get access, if you guys can get access to Zoom, but one thing that could potentially work is utilizing Zoom breakout rooms to have smaller group discussions. I know sometimes it's a little bit easier for people to share when they're in smaller groups. So that could be just an option organization-wise.
For Lincoln County Health Promotion, we don't have Zoom currently, though there's been talk about getting the platform, but that generally takes a while for us. We do have partners who have Zoom. I know OSU Extension has Zoom, and I know there's Teams and different platforms. So if we wanted to do that, we would just work with one of our partners to set that up. There's also the structure that Rosa described for the Coastal Equity and Inclusion Committee, where they meet every other month. And in between that, maybe the work groups meet, or maybe we just, go about all of our other meetings and then just come back to touch base, have a spotlight on a new organization or new grant opportunity, or that's when we do those capacity building workshops. So what are your thoughts about kind of spacing of meetings?
I think every other month might almost be too much. I know we're all involved in so many other things, and then it's like, oh wait, that's coming up, and I totally fell off the radar. So like keeping it a little bit more regular. I'm not saying like once a week or even, but once a month might seem more. And then maybe just to keep it more relevant, to have some kind of, like, it could be a really small action item, but like some little thing that we all have to bring back to the next meeting. Like, what if you like, and it could just be a little 10-second report out, or even a line that we emailed before the meeting, but like just so that we're keeping the meet like this group relevant, and it's not just a calendar stock on our time. That's my thought, but I'm willing to go either way anyway on it.
I saw Jolene also mentioned once a month in the chat box too. One thing I want to point out is that we have the Lincoln County Health Integration Network, which does a very similar process, and that meets once a month. And so there's possibility of utilizing that existing meeting structure to meet more regularly. And I mean, that's going to cover more things, but we can also include discussing CHIP in like things that are happening that relate to our CHIP goals in that meeting. I don't think it'll derail it too much, and it really fits very well with that. And then perhaps we have once a quarter or once every 2 months, you know, that kind of this is focused on our community health improvement plan. Let's report out on our progress. Has there been any programmatic things that are happening that fit underneath these goals? And that's how we can track doing movements towards our CHIP. What are our thoughts on that one?
Amy, I would like to support rethinking how the Health Integration Network can either combine with this, or you know, if it's duplicative, or we can use that to build upon this. I think it would be great to talk with the meeting next week, I think it is, with the group members there, and because I think many of the members of that group were forming to get together to learn about what each other are doing and try to be collaborative and have opportunities to connect. So we can talk with them about that opportunity.
And there may be certain groups, like the substance abuse prevention work group may have more interest in doing some work with recovery, and that if the Health Integration Network doesn't fulfill that need, we could also have separate work group or priority area groups that are chaired by someone who wants to coordinate those, and we can also help lend support for that. But I know for us, you know, we have very limited resources right now with our responses and just the extra activities that are happening with that. And so we could, you know, focus our efforts on that more occasional meeting. It still would be regular, but wouldn't be as regular, but we could still use that Health Integration Network meeting as a more regular touch base.
Yeah, I agree with you, Amy and Dusty. I think because of the emergency, we kind of created one too many meetings that all of them were necessary at the moment, but hopefully the COVID will be better, get better, and then we already started to merge meetings because we were duplicating. And like in my case, my my job is do the benefits eligibility work, and as a chair of the coastal, I have time for meetings, but they're getting too many meetings, and I don't know how much I can stretch that time. And so yeah, it's a good idea to merge meetings depending on the purpose and be more effective.
And one of my thoughts on going to a quarterly meeting is that, you know, if we're doing this once every 3 months, then there might be a little bit more effort to be able to get everyone to the table for that one time, rather than if it's every month, then we're hit and miss, and then we don't really have everybody at the table that we need to touch base and to do that collaboration. Though we could still chisel off and have like the smaller meetings more regularly for more focused work, particularly for like our healthy living, nutrition, food-oriented groups. There's a lot of different meetings that I'm sure you're already a part of, or it would be more appropriate to have a meeting that's focused on the nutrition and food service activities rather than the larger big group meeting.
Amy, can you put it up to a vote?
Ooh.
How many ayes and nays?
Yeah. Should we just, let's see, not everybody has a video camera, so we can't do just like hands raised. And I'm seeing some people are on the phone, so they won't be able to put in the chat box. Does anybody have any ideas of how to vote?
I have a quick question. which may or may not affect the vote. Did we want to talk about base camp, or you're thinking that's something separate? In my mind, and I'll explain for those of you unfamiliar with base camp, I will explain in just 1 second. But Amy, in my mind, if we're not meeting regularly, this is a really easy way for people to stay in touch and get updates. So even if we don't have, you know, a 1 or 2 hour meeting once a month, you're still in communication and you can still track all that progress without necessarily everyone being available at the same time. So I don't know if that influences the vote or anything like that.
So we have access to be able to create a base camp for this, and that's something we were going to propose doing, which would help us be able to have just like a one-stop shop where we can store all of our resources, keep minutes or list or do that communications, you know, more frequently. But I think, I don't know, does that affect anybody's interest in how frequently we meet? I think they might be separate. So we'll circle back to that one.
One thing about base camp is that I think it can be really valuable, but I'm a member of like 3 different ones. And one particular one I'm thinking of, I get probably, I don't know, 18 emails a day from it. And they're all like little responses. And I know you can switch them off, but then you miss some of the really salient information. So it can be a little overwhelming if you're a member of multiple ones. And if you're already trying to deal with, like, you know, managing email crush, then it might be problematic. Or maybe like thinking about how we respond to email. I don't know, just like making it, if we do go the base camp route, make sure that we're not inundating people with too much unnecessary email.
I think the key is to make sure that those settings are, you know, turned off, because the benefit from my mind is that, and I'm also a part of a few different base camps. The benefit is that it's all in one spot. And so if Sarah has something really important she wants to share, you know, I can go back 6 months later and I can pull it right up right away versus, you know, in my inbox, especially like this year, I mean, at any given time, I have over 1,000 unread messages that I will honestly just never get to, you know, and I know a lot of you guys are in that same boat.
But that's the problem with Basecamp is I played with the settings on one of them and I missed a lot of really important things. I'm like, oh, I'll get to that. But they were coming in so quickly and they got buried. And I mean, it's a really good platform for a lot of reasons, but you have to be really mindful of how much information is being, I mean, you know, like I'm getting an email that says yes on it. And I'm like, fun to the whole group on that. That could have been anyway, that would be my one concern about it.
And I think for going forward, if we select to use Basecamp, we would have just kind of a tutorial and just kind of community agreements on how we're going to use it, just so that we're aware of if there's, you know, when you respond and it goes back to everybody, of that kind of phenomenon of the reply all. So getting back to voting on frequency of meetings, let's say, should we go around? I'll just call on everyone and we can just say what your frequency, what you're thinking about for frequency. And I'll just go around in the same order that my list is in. So Jess, what are you thinking?
I like every other month, but I'm flexible.
And Isabel?
I like every other month as well.
And Griffin?
That works for me.
And Pat?
Do with quarterly or every other month, whatever it turns out.
Janine? You're on mute, Janine.
There we go. Sorry. I do like the more frequent meetings, so every other month is good for me.
Rick?
I concur with Pat, either every other month or quarterly.
Sarah?
I mean, daily would be great, but I would also go with every other month or quarterly would be good too.
Dusty?
Quarterly would be great. And then inviting people to attend the Health Integration Network meetings to give updates as they'd like to, I think makes a lot of sense.
Hey, Sally?
I don't know if I really have a say, but quarterly, every other month, either is fine.
Beatrice?
I prefer quarterly.
Jolynn?
I was gonna say monthly, but honestly, I guess everyone else is saying every other month, so I think I'll just say that as well.
Peer pressure. Stephanie?
I think every other month or quarterly is fine, but maybe lean toward quarterly.
Leslie?
Dusty had the same vote as me as far as quarterly meetings for this group, but encouraging people who want to meet more regularly to join the Health Integration Network just to align as much as possible with what's existing.
Thank you. Jennifer?
Yeah, I think quarterly, and then, they really count, like you were saying, Amy, gather all the really pertinent, good stuff and come together then. And if there's needs in between, then you can probably figure out how to come together in smaller groups.
Thank you. Sheila, sorry. I say it one way in my head, but I know it's pronounced the other way.
Totally fine. I'm okay with any of them. I like the idea that Dusty put forth of having just kind of a tracking mechanism with the Health Integration Network meetings. And I think that's just my main concern, is that we let it get put on the back burner for too long. So as long as we have that check-in mechanism, I think it's great.
Thank you. Shelby?
Yeah, I like the idea of utilizing the existing health integration network as much as possible, then either doing every other month or quarterly, more dedicated to this group.
Rosa?
Same, quarterly, with the same notes that Dusty was pointing.
And Carol?
I'm with Rosa. By the way, Rosa, if I have a party, I'm going to invite you. So anyway, quarterly.
So I'm going to look over my list right now because I wasn't counting, but I just wanted to see which, because a lot of people said every other month and a lot said quarterly. So I'm just going to try to count up really fast. Though if you want to have any kind of discussion about anything, you're welcome to do that while I count, because numbers are not my skill set.
So I wanted to share something before the meeting's over from the Coastal Range Food Bank's perspective, because we're just a little food bank. But right now, we have two children who are young women now. They're in their early 20s, and they both came to the food bank as toddlers. And one is, we interacted with her, and we also interacted with the other one's family. One was with her horse trailer and all her animal knowledge, going and rescuing and saving animals with the fires and bringing them to different homes and being really active. And the other little girl is right now sitting in the Lincoln County Jail. And the discrepancy, they both had abusive situations. They were both sexually abused. They both had financial stresses. These children's lives were nothing but stresses. And my dilemma is, how do you reach out to the one in the jail and help save her? And how do you applaud the one, and why did they take such different roads? And that's really and truly the passion that our food bank has, is trying to figure out what to do to ensure that these children have a good, strong life. Okay.
I have to say I have so many thoughts around what you just shared, and I thank you for sharing that. And maybe sometime you and I can have a conversation. And I'd like to share some resources with you and maybe see about getting, when we can get, I'm gathering you would, if you haven't done any trauma-informed care training, you would find it really fascinating and interesting to see what trauma does both to the brain and to people's response to trauma, and those outcomes for those early adverse childhood experiences, but also what helps create resiliency. So you have two really great examples of early trauma and things that occur in somebody's life and the directions that they go. If you really walk through that, you could probably find some of those things that helped make one more resilient than another, and we could talk about how we can create those community supports to help resiliency. We can't prevent all of the trauma all of the time, but we can create those environments and those places, and it sounds like that's what you're doing with the work you're doing, is to provide that support. So, I could talk for a long time about this, but I'm going to connect with you later.
Okay, thank you.
And Sarah has some resources she could bring out, the One Caring Adult resource that we have with some of our mental health promotion work that could be hung up at the food bank. And I'm also going to call you, Carol, because I want to talk to you about having a syringe exchange event out there where you are, because we are about to start launching that again. But to get back, we have 2 minutes left, and I know some of us have another meeting coming up soon. We had 10 votes for every other month, and we had 11 votes for quarterly, and I didn't vote, so my vote would have been the quarterly. So we'll have quarterly meetings, but we are going to encourage the going to the Health Integration Network meeting. And I'd say also be going to that Coastal Equity and Inclusion committee meetings too, and that helps us get our equity arm. So we'll send out some follow-up emails promoting those two meetings, getting the contact information out. We'll have the transcript basically of all the comments that will be with this video being available on our website. Who was it that, Sheila, would you send me a copy of your slides so that we can share those as well? And so we'll have that accessed out to everyone. We will probably set up a base camp just to share resources, but we can still talk further at the next meeting of how we want to use it and whether we might want to use something else going forward. But at least we'll have just a one place where we can get it. Sometimes our website is not the best place for that. And so Basecamp's a little bit easier for us to use. Well, thank you everyone for joining us. It has been a long awaited meeting, and I'm so happy we were able to bring us together. It's not the most ideal, but it is happening.
Bye-bye.
All right, thank you everybody.
Thank you everyone.